Why should I vaccinate my child? I'm Dr. Dan, board certified pediatrician. Let's talk about vaccines. So vaccines are a huge topic. I'm sure it's going to take multiple episodes to go through everything. So the best way to kind of crystallize a short talk to discuss the importance of these vaccines, let's talk about the 2-month visit. A baby comes in with mom and dad. They're a tiny little bundle. The parents are exhausted because they haven't slept for the 2 months. And all they want is for their child to be safe and healthy. And you're going to come and talk to them about giving them 3 injections and an oral vaccine, of which all they've heard in social media are little fear bullets of these are poison, they're dangerous, they have terrible side effects. And for me, that really bothers me because in truth, in the history of medicine, there have really been 3 great inventions in my estimation: soap, toilet, and vaccines. And there's nothing that has changed human medical history more than those 3 things. Vaccines are an amazing technology that has changed the way we deliver medicine and protected millions and millions of kids throughout the world. So we're going to talk a little bit about this, and I'm going to try to dispel some of the myths by putting it in the setting of how do you talk about that with a group of parents with a 2-month-old baby? So first of all, they're going to ask, why so much? In these 3 vaccines, we're protecting against 5 different things in one of them, including tetanus, pertussis, diphtheria, hepatitis B, and polio. In one of them, we're protecting against 20 types of what's called strep pneumonia. And the other one is something called Haemophilus influenza type B, which used to be the leading cause of meningitis in kids. And then they get an oral vaccine against a virus called rotavirus, which is the leading cause of diarrheal dehydration. And the parents go, whoa, 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 whoa. That's a lot. How about we slow down and only do 1 today? So let's talk about why. So first of all, vaccines are one of the most studied pharmaceutical agents known to man. There are not thousands of studies or thousands of people. There are millions and millions of children that have been studied. And these schedules that have been designed over decades to ensure the safest, quickest, and most effective way we know how to protect your child from things that literally, unfortunately I have to say this, could kill them. And used to before vaccines existed. As far as the breaking up the schedule, that's a false sense of control that some parents would have because they say, well, I just don't want to do them all today. What I tell them is that's really puts your child at a few different risks. One, we're not protecting them as quickly as we could against these dangerous things because we want to get their vaccines to learn how to do this more quickly. You have to keep coming back to the doctor's office, which is the land of the sick. And 3, it really has been studied to be safe, and just slowing it down is really a way you make yourself feel more comfortable when in fact it's more dangerous. The analogy I like to give parents is imagine you're on a highway. You decide to drive your car 20 miles an hour because you have much better control when you drive slow. What's going to happen to someone who drives 20 miles per hour on the highway? Accidents. That's what happens when people break up their vaccines. Because they're scheduled in certain times and durations, when you mess with them, things invariably go wrong. So it's always a good idea to try to stick with the schedules. The second thing they worry about is that, oh my gosh, that's so much. And that's actually, again, a false idea. There are more bacteria and viral types that we protect against now. But if you compare the vaccines of the 1970s to now, let's just take the pertussis component. Pertussis is whooping cough, which can kill babies. It's annoying for teenagers and adults, but it can literally kill children. They stop breathing when they get whooping cough. It's horrific. Back in the 1970s, the whooping cough vaccine, the P in DTaP, the P component had 3,000 antigens in it. Because what it was is they took the whole bacteria and kind of ground it up, and that's what was put into the vaccine. But what they found over time was that much antigen had an increased risk of side effects. So they purified it. They brought it down to the things that we only needed. And now there's 5 antigens, 3,000 to 5. So there are vastly fewer things in today's vaccines that we're exposing our kids to. Not to mention the other falsity about that is the immune system is meant to multitask. Think about your toddler going around on the ground. They're walking with their hands and knees, they're crawling, and where do their hands go? Right to their mouth. You think there's only two things on there? We don't live in a sterile world. The idea that we're giving too much is false. What about the side effects? What I'll tell every parent is the most common thing that happens after getting your child vaccines at 2 months old is nothing. 85% of the time, nothing happens. Child isn't irritable, nothing. There is about 15% of the time that the child will be irritable afterwards, maybe a little cranky, they may be a little tired. Sometimes they do get a local reaction at the site of the injection. Those things are all manageable with a little bit of Tylenol for the pain if you want, or a cool compress, and they go away in 24 to 48 hours. 5% of kids may get fever. And yes, it could be a real fever, but it's only going to be there the day of the vaccine and potentially a day after, and that's it. If the fever goes longer than that, we come back because it's probably something else. So now I'm getting the parents to understand a little bit about the risk that they thought was there that isn't. The final thing I like to tell them is I want you to think about it this way. I've read a lot of studies in my day. We were trained how to read these studies. That's my job. And I gave every one of these vaccines to my own kids. Why would I do that? I like your kids. And why would they deserve anything less than what I would give my own? So the best question you can ever ask a pediatrician or any doctor really is, what would you do for your family? And I'm telling you right now, I'd vaccinate my kids all over again if they needed it, because the risk is just too high. And the main reason I know that is, unfortunately, I've seen these diseases. And that's the reason that the fear gets to propagate through families and through the world and through social media, is because vaccines, most are so effective, we don't even know what the diseases are anymore. Ask yourself, do you know what tetanus is? I'll give you a second. What is tetanus? Right now, all of you are thinking, that thing when I get cut by something dirty. And I'll tell you, no. That's how you get tetanus. Tetanus is caused by a bacteria called Clostridium tetani that lives in the ground. It's everywhere. When you get cut by something dirty, be it a stick, a dog bite, or rusty nail like we all think, you can get inculcated with tetanus, meaning that it gets inside you and the tetanus bacteria releases a toxin. That toxin paralyzes you. And back before vaccines and back before antibiotics, if you got tetanus, your whole body would stiffen up, your jaw would lock, and that's actually what they called it, lockjaw, and you would starve to death. The reason why we don't know about this anymore? Vaccines. You're welcome. If you don't believe this, look back, right, 2019, Oregon Tetanus ICU. There was a 6-year-old boy, very healthy, living with a loving family who did not want to vaccinate their child, who unfortunately got cut. He was in the ICU for 57 days and only survived because we have modern technology to save him. Over 57 days and $800,000 worth of treatment, where one shot and a little pain at the site, he wouldn't have got that. I'll look at families and always use that line about, I like your kids, I love mine, and I'll be the one to tell you firsthand, the vaccine is the best way I know how to protect your family. There'll be further episodes about this going into vaccine technologies and the different types and why one vaccine feels different than the other. And maybe even one day we'll talk about vaccines and autism and the fact that they don't connect. But for now, you ask your pediatricians those questions, because if you're educated about this, you'll see this is the best way you can protect your child and the community around you.